Honorable Dixon, you are doing very well. His Excellency, the Deputy Governor of Bayelsa State, members of the National Assembly here with me, members of the Federal Executive Council, the Honorable Minister of Health is here, the Honorable Minister of Niger Delta Affairs, and the Honorable Minister of State Education, and I believe one or two others have not cited. So you are welcome to my tiny village. Let me appreciate my Deputy Governor, Prema Boyebebi, for being here with us. Members of the State House of Assembly and members of the State Executive Council, other very senior citizens of the great state and the country are here with us, and His Royal Highness, the Obanema of Otueke, and other traditional rulers here with us, distinguished ladies and gentlemen. I am very pleased to be here today for the commission of the Otueke Cottage Hospital. I recall that the construction of this model hospital began in 2006 as an initiative of the Bayelsa State government. It was later taken over by the Millennium Development Goals, the MDG office, also with the collaboration with the Bayelsa State government. It is most gratifying to come back and witness not only its completion, but its formal commissioning today. All this has been made possible by the hard work, diligence, and perseverance of all the stakeholders. I salute you all for a job well done. Nigeria, a great country, is faced with a number of developmental challenges which we have tried to confront since the inception of this administration 2 years ago. We embarked on the reform of several sectors of our national economy with single-minded commitment and determination. I am glad to declare that we are making significant progress in all sectors, as is evident for all to see. The health sector, as you all are aware, is a cardinal priority of our transformation agenda. You've heard from the Honorable Minister of Health. Attainment of universal health coverage and the provision of comprehensive health care for all our citizens is a goal we have set for ourselves. Today's commissioning event, therefore, not only underscores this commitment, but also represents yet another milestone in our drive towards actualizing the health-related goals of the MDGs. This model cottage hospital, I am told, of course, you heard from Precious, who has given us a precious gift. It's well equipped. It's 40-bed facility with a well-equipped laboratory, a surgical theater, an outpatient department, an emergency and casualty ward, 2 blocks of staff quarters, an administrative block, and a morgue. She also said that they have oxygen plants that the whole state will be able to use for now until we complete, the government completes the ones in Nagua. I am therefore confident that this hospital will no doubt cater for the medical needs of not only the people from this village, but all the neighboring communities and even beyond. I welcome the collaboration between the Bayelsa State government and the federal government, which has made today's event a reality. I urge the government and the good people of Bayelsa State to consolidate this collaboration. Let me especially thank the governor of Bayelsa State and members of his team, and indeed my brothers and sisters from this state. Let me also use this unique opportunity to tell Nigerians that as a government we are working extremely hard to meet up our Millennium Development Goals. As at 2008, we had 500 deaths for every 100,000 births. That is women. 500 women die out of every 100,000 women that give birth to children. As at now, we have reduced that to 350. The target for the Millennium Development Goals is 250. And God willing, before the end of 2015, we will get that. Of course, you're also aware that only about 2 Sundays ago, we are honored as one of those countries that have met our Millennium Development Goals in terms of nutrition. We are given an award in Rome. We'll surely get that for the health too. Sometimes when you are in one place or your movement is limited, you think that nothing is happening across the country, but a lot of things are happening. And that is why we always ask people to go through our midterm reports and listen to the ministers. And I'm happy that my good friend, my sister Dayo, is coming to my tiny village for the first time. You are welcome. Finally, let me take this opportunity to thank the various stakeholders whose work facilitated the completion of this project. I wish especially to acknowledge the role of the state government, the Minister of Health and the Ministry of Health, the Minister and Minister of Lands, Housing and Urban Development, and of course, our dear precious, the Senior Special Assistant on MDGs, who has been working tirelessly to make sure that even with the devastating impact of the floods, that the facilities have been brought to life. I commend their diligence and dedication to this national assignment. Your Excellency, Your Royal Highnesses, distinguished guests, ladies and gentlemen, I thank you for sharing in this memorable occasion. To the people of Otueke community, my community, who are the primary beneficiaries of this project, I say and listen, this facility belongs to you and you must guard and protect it jealously. And I have to admonish that we expect host communities of federal and state government projects to take ownership and ensure that they maximally utilize and maintain to the highest possible level such facilities. Government will not continue to patronize communities that vandalize government installations. If you vandalize government installations, that means that you don't want your children to progress and will allow you to stay there. So any community that a government, either a state-owned project, a federal government project is located, we plead with the leadership of the community to make sure that they protect such facilities. Distinguished ladies and gentlemen, it's now my singular honor to proceed and formally commission this Cottage Hospital for our use to the glory of God.